Hey, we're on. Live.
You're on the internet. It's live. Good morning, everyone.
And so those video animation and then the video it focuses on interviews and your share out Coast Guard and so any of that so yeah, and lots of graphics cues actually produced each signs and
Okay, ready?
talk to them about
8:29. So.
Oh yeah. So Matt Warner also yeah, he's your guy. Yeah. You're welcome. Nice meeting you.
Oh yeah. Yeah, and we're still breaking eggs and learning how to do it, but it's good time.
I won't leave you.
Do you want us to do timekeeping in the back, or do you want to do it? Or?
I have my phone, so, but I like the back is good.
Yeah, that way they're not looking at you and like, oh.
Yeah.
All right, so we'll put it in the back.
Okay.
Yep.
We're gonna go.
So just tell them when they come up that we'll be the timekeepers in the back.
Okay. Good morning, everyone. It's 8:30. We're going to get started. My name is Eric Wiegert. I'm with the New York State Department of Health. Very happy to be back at Great Lakes Beach Association meeting. It's been a number of years for me since I've been able to attend due to travel restrictions. They've been opened up, and I'm very happy to be here with you all. This morning, we're going to be discussing exploring ways to reduce swimming fatalities. And I think we'll all agree that we're all explorers here. Is everyone an explorer? It's the morning session of the last day. Are we all explorers? Let everyone on the webinar know that we're explorers. Again. Thank you. Some housekeeping rules. Cell phones. Set to stun. This is the beach track room. So if you're going to be doing beaches, you'll be here all day. If you're not here for beaches, go to the information desk and they'll help you out. The Freshwater Summit is downstairs, so I've heard. Without any other delay, we're going to introduce Megan Dodson, who is a meteorologist with NOAA on the National Weather Service, to be discussing applications from the Great Lakes Current Incident Database, beach safety and forecasts.
Thanks for coming this morning. Like I said, I'm Megan Dodson. I work with the National Weather Service in Northern Indiana. And I'm going to talk to you today about a little hodgepodge. The title's kind of misleading because not only do I want to talk about the incident database and what we've learned from that about drownings and fatalities, or rescues and fatalities on the Great Lakes, but also talk about some of the tools the Weather Service offices offers for people who want to keep people safe. So beachgoers and the public alike, and also beach managers, so people that are at the parks, some of the tools that we offer to help you keep people safe. And the last thing would be a little bit of ways to collaborate together more efficiently. So I often find that a lot of people don't even know what the Weather Service does. A lot of times I say, oh, I work at the Weather Service, and they're like, are you on TV? Like, that's the first thing out of their mouth. So I'm like, not exactly. Are you on the Weather Channel? No. We're those annoying people that interrupt your favorite TV show to say there's a severe thunderstorm warning or a tornado warning. And we do that because our mission is protection of life and property. This is my famous favorite tornado picture, so I threw that in there to keep you guys awake and on task this morning. But it's the only one. So obviously, when you think of protection of life and property, enhancement of the national economy, marine stuff comes to mind because obviously we want to help save lives due to dangerous currents, waves, lakeshore flooding, all sorts of hazards in the marine world. So protection of life and property is our mission. But we also have a vision, and that's to make sure we have what we call a weather-ready nation. So we want society to be ready, responsive, and resilient to the impacts of extreme water and weather events. So from all the way from the bottom scope of, like maybe flooding and evacuating towns and things, or down to just putting up a beach flag. So whatever things that can help keep people safe is what we're interested in contributing to. So ready, responsive, and resilient to the impacts of extreme weather and water events. So how do we do that? Basically, we provide data, we provide forecasts, and decision tools to help you make decisions that you need to make. We have 122 weather forecast offices, so it's not just one office. Most people work at 2 or 3 different offices throughout their whole career. I've worked myself at the Detroit Weather Service, the Marquette Weather Service, and now I'm at Northern Indiana. So we kind of travel around, and we work rotating shifts because we're open 365 days a year, 24/7. So rotating shifts are fun. So if you get an email from me at 3 in the morning, you know why. So as far as, it's more than just the daily forecast. A lot of people also think that we sit down at our desk at work and we just say, what's the high going to be today? What's the weather going to be today? But it's a lot more than the daily forecast. We're involved in special program areas within our office. So in my office, obviously we have a lot of fatalities in Berrien County, Michigan, and LaPorte County, Indiana, and that's our marine area. So we have a big marine program. Other offices might focus on fire weather, so times where you might need to send a meteorologist out to a fire to protect the firefighters, or flooding, or even hazmat situations. So if there's like an explosion, we can staff the EO's Emergency Operations Center and help them out with where the smoke plume might go or the chemicals might go so they can evacuate. So it's a lot more than just sending out warnings or forecasts, which are important aspects, but it's more deep than that. So when the weather's quiet, what we do is we spend a lot of time on research and projects, education and outreach related to our program areas. So obviously, since I'm here, I'm a marine beach hazards person. That is where I spend the majority of my time. And so we try to make people ready, responsive, resilient to marine hazards. So that's dangerous currents, lakeshore flooding, high wind and waves, and also even harmful algal blooms, which is kind of a thing that I don't know much about yet because our office doesn't deal with it, but I'm sure many of you know about it. So we try to make sure people are the most prepared they can be to deal with those things. So I'm kind of a weather nerd, and I'm also a water safety enthusiast. So I spend my time doing a lot of forecasts and warnings, but I also participate in a lot of education and outreach and do presentations to make people aware of our incident database, which is the research I do, and we'll talk about in a minute, because it's important for you to know so you can apply the knowledge I give you to make the beaches a little bit safer. So my joke is always, I want to create a water-ready nation. My office always makes fun of me because I'm like, it's not just weather, it's water-ready nation. Society prepared to swim in the Great Lakes. So I'm going to lecture you about it today. But also it's also that I want our partners to have the data they need to help support their safety decisions, to help make the beach safer. So we try to make products and web pages and things that will help them make a decision in the morning about what they're going to do that day. So the Great Lakes Current Incident Database is where I got a lot of the data that I'm going to use in this presentation and what I'll show you in a little bit. It's basically a collection of 469 incidents, that's fatalities and rescues, that are specific to the Great Lakes. It was started by Dave Gunther, who was from the National Weather Service in Marquette, and he was like my mentor, basically. And he was actually contacted in the late 90s when Travis Brown, a young 12-year-old boy, drowned off in that little box there up near Mackinac County in a rip current. And they didn't really think much about rip currents happening on the Great Lakes at that point, so they kind of reached out to the Weather Service and said, can you help us forecast or put out a statement that will alert people to the hazards of swimming during these conditions. So Dave set out to better understand currents, so he started collecting data. Like he would write down, he'd look through media articles, write down, okay, is this a current-related incident? If it was, what were the waves, what were the winds, and all that other information. So that was his goal, is to improve forecasting and outreach and hopefully save some lives. That's just the beach where the drowning occurred. So once Dave retired, I took over the database. Dave's database was a pile of papers and very, very well organized pile. But I was like, we need to put this into Excel. And then so we put that into Excel and it kind of grew and we started sharing the statistics, and then Elizabeth LaPorte and the folks from Coastal Zone Management, Michigan Sea Grant, MDEQ helped us to get that data online. So it's available for you to use. So yay for them. But we add the data every year. It's still going. So the data from 2002 to now, you can access it online. So yay. So what did that database teach us? Basically, we learned from reviewing those 469 case studies a lot of things about where the incidents occur and when. And so we'll go over that so you can learn. When you look at the distribution of the incidents across the Great Lakes, the first thing that probably catches your eye is the darker colors represent the higher number of incidents, which is both rescues and fatalities. That southeastern Lake Michigan is a hot spot. And there's a lot of reasons for that, but I will say right off the bat that in Canada, our data is very underdone. So Lake Michigan appears to have way more incidents than the rest of the lakes, but I believe that's because I'm not, actually know for sure that I'm not getting all the rescue data. It's very hard for me to collect incidents there. But now I have new friends that might help me out with that data collection. So stay tuned on that. But in the meantime, you'll notice a lot of the incidents are clustered near cities. So places that have a lot of people, there's a higher number of incidents. This data isn't really compared to population or anything. It's just the straight data. And it's also where we get a lot of tourism. So obviously Southeast Lake Michigan is a tourism city. So Lake Michigan has a total of 335 incidents as of 2015 data is included in that. And then the rest are below 60, but one is one too many as far as I'm concerned. So incidents usually happen from June to September because as the water temperatures warm, the air temperatures warm, more people are swimming. So towards late July, early August is when we typically see most of our incidents. There are some rare ones that are later in October. This year we had some in October because the weather's warm enough, people will still go in the water, but typically once the water gets cold, they're like, no thanks. May and June, you don't go in Lake Superior. It's a bad idea. Your feet will freeze off. So anyways, as far as who is the drowning victim that we usually see, our database had 69% males, and this is really common for drowning across the Great Lakes and across other areas of the world even, is that males take more risk when they're in the water. Us ladies tend to be a little reasonable, so we are like, that's not probably a good idea, but those guys like to show off their legs, so they're always in trouble. So that's a common thing. In addition, those adolescent and young adults are also in that risk-taking category. That's another common theme of drowning across the world. So most of our victims are 10 to 27, that general range. This is kind of interesting. It's the distance of how far the person was from their hometown when they drowned at the beach. So for example, if someone lived 30 miles from the beach where the incident occurred at, that would be recorded as 30 miles. So you would think most of the people that drown are tourists, but it's actually within about 90 miles. Most people are making those day trips to go to swimming at the beach. So it's not exactly, people that are 300 miles away that don't know stuff about the Great Lakes. There's actually a lot of locals that don't know much about the Great Lakes as well. But I think that goes back to the age group that we're talking about, the risky young adult teenagers, teenagers. So as far as dangerous currents go, the short story is they form when water piles up near the beach. So things like larger wave heights, longer wave periods lead to the water to pile up more efficiently. Gentle sandy beach slopes help, and also if you have some sandbars parallel to shore. So for those of us that live on Lake Michigan, that's kind of ringing some bells, like, oh, we have a lot of that stuff. Other things that help are shoreline structures, river outlets, sandbars, like we said. When I say outlets or like river mouths, I also mean power plant outlets. We have a lot of people that like to swim near the power plants for some reason, or these facilities that put out warm water, probably because the fishing's good or something. I'm not sure why they stand there, but they get caught in those currents, they get into trouble. And then when I say structures, I don't only mean man-made structures. In this example is this Presque Isle. My friend Jamie, who's actually here today, was caught in a current that occurred right near that peninsula there. She couldn't swim parallel to shore. It was because it was right near that structure. It was acting like a break wall. So you want to make sure that when you're thinking about structures, it's not just a break wall or something like that. But when you look at Lake Michigan beaches, not only do they have the favorable sandy beach slope, but you also have piers and break walls. You have those nice sandbars along the shore. If you want to get real nerdy, go onto Google Maps and zoom in. You can see rip current channels. It's a fun afternoon activity. So this is a cool diagram developed by the Great Lakes Surf Rescue Project that's I'm going to use to explain the current types really briefly. But essentially what happens is the waves approach the shoreline at an angle. The water starts to move parallel to shore, and that's what you call the longshore current. This is generally responsible for about 1% of our incidents in the database. So it's not that many alone. However, it does contribute indirectly to other incidents. So for example, if you're setting your stuff right near, over here on this corner, and all of a sudden you're drifting down the beach and you're not paying attention, you might get wrapped into the structural current near the pier. So you could get caught in that current and pulled out. A lot of people report that they didn't even realize how close they were getting to the pier before they were pulled out. So that's something to make sure you pay attention to. And about 50% of our incidents occur near break walls or similar structures. So that's an area that we need to focus on keeping safe. So channel currents are a little less common, 3% of the incidents. These are all mostly up in Marquette and the UP. We've had a lot of places where offshore rocks or islands maybe, people try to walk out on the sandbar and get swept off the sandbar because that water is getting funneled between the rocks and the shore and also up and over the sandbar. So they're walking along and all of a sudden they get pushed off, they start to panic and they drown. We also have rip currents. Those are the ones within the sandbars. So if a weak spot forms, those waves come in and pile up between the sandbar and the shore, and that pushes out the weaker spots in the sandbars, and that can cause an outward flowing current. That's about 38% of our incidents. And last but not least, 9% of our incidents occur near the mouth of rivers or other outlets. So we have a lot of incidents, but the main thing you can get from this is that a lot of them occur with rip currents during high waves. So we have our phrases Elizabeth may talk about later is stay dry when waves are high and steer clear of the pier because you can get into a lot of trouble there. So as far as the wave heights during the incidents, we had about 85% of them. As the waves get higher, you start to get more rip current activity, but you notice it drops off dramatically after 6 feet. It's because most of us are like, I'm not going in that water. But if you are brave enough to venture in, you can get into a lot of trouble. So most of that time is where there's both currents and people in the water and the waves, of course, themselves. There's a few that have 0 to 2 foot incidents. Those ones you'll notice are mostly near structures and outlets. So even when the wave heights are a little lower, you can get into trouble near those features. A lot of them were channel or longshore currents, and some of them were as wave heights were decreasing from an earlier event. So maybe it was 5 feet overnight, and then as people started going in the morning, maybe the waves were only 1 foot, but those currents are still going because they have to slow down. The momentum is still keeping those going. So we tell people stay away from those shoreline structures and outlets. If you're a park person, you're working with those flags, make sure you're keeping the flag up a little bit longer after those conditions subside because there could still be some currents. So wave period is the time in between each approaching wave. So the shorter wave periods, generally, it's hard for swimmers to recover. So if they get knocked down, they got about 3 to 4 seconds to get back up before the next wave comes in and hits them. But the longer wave periods, on the other hand, could indicate that there's a larger volume of water on shore, so there's a higher risk for current activity. So since the average wave period on the Great Lakes is about 4 to 5 seconds, that's what we see with most of our incidents. And as far as the direction of approach, so when the waves approach the shore at a direct angle, that helps the water to pile up more efficiently. So about half of our incidents are with that more direct approach because that's when you're going to get that stronger current development. When waves are approaching at a 45-degree angle, that can cause a stronger longshore current and a stronger structural current. So those are the times we see the most incidents. So as the wave or wind direction you can use as a proxy becomes more shore normal, incidents are more likely, assuming all other factors are favorable. So going back to our map that we saw earlier, another reason Lake Michigan sees a lot of the incidents is because the prevailing wind direction is from the west. So you notice even on Lake Huron, there's not as many incidents on the western shores of the lake as there are on the east because that's where you get that prevailing wind flow. So some of the tools we can help to keep you safe, whether you're just a public person going to Michigan beaches or you actually are a park manager wanting to know what the conditions are going to be like that day, the Weather Service wants to make sure you have the data and the forecast and support you need. So we have a lot of tools to help you do that. Some people don't realize that the Weather Service is, like I said earlier, available for more than just forecasts. We're there to help you. You can give us observations. We can talk about the forecast. Maybe you notice something about the waves that was wrong in our forecast, and we can talk about it. Or we can just exchange information on incident database. So you can help me make my data a little bit more accurate. We can also do training, so teaching park personnel or lifeguards about what kind of conditions cause occurrence, what we've learned about the database. So we're available for a whole host of things. I know that we can also combine outreach efforts at booths and fairs and things of that sort. So long story short, with the forecast that we put out, we assign a swim risk. So we go from low to moderate to high. It's like a stoplight, so it's pretty simple to understand. High risk would be life-threatening waves and currents are expected. So even if you don't remember all that stuff I just taught you about how currents develop, you can check our webpage and we'll do the forecasting for you. So breaking waves and currents are expected during moderate risk, but they might not be as strong. And then, of course, the lower risk. But when we put out a high swim risk, we issue what's called a beach hazard statement. And that goes out and it tells you more details about the type of currents to expect, what side of the breakwall might be more dangerous, and a little bit more about the details of the forecast. So you can use that in the morning to make your decisions. Usually that's out by 5 a.m. So this is what our webpage looks like. You can find it here. I also have handouts I can give you this afternoon. But when we have a high risk, so you could just move your mouse over it and the window will pop up and tell you what the forecast is and what the risk level is. And you can click on it and it actually will bring up the beach hazard statement text. So us government folks are really awesome at making confusing websites. We're trying to help you. I'm trying. So this is our newest experiment. You can also get other data like radar data overlaid on it and also access information about water safety. So the incident map I showed you earlier is interactive here. You can highlight over it and get the number of stats for your area. You can also access the dangerouscurrents.org website by clicking on those links below. We also type up summaries every year, so the 2015 summaries are up now, so you can access that as well. So knowledge is power. You guys know now what kind of conditions, where the locations are for these incidents to occur. So now the next step is applying it to your area of expertise. We had risk communication studies that were done specifically to talk about beach hazards on the Great Lakes, and they found that we're going to need a combination of messaging, policy change, and modifications to the environment to change swimmer behavior. So I can sit here and forecast this stuff all day long, but if you guys don't take this information home and apply it to your area of expertise, we're not going to get the swimmer behavior to change. And that takes collaboration, and that's really important piece. Everybody has a piece of the puzzle to bring to the table. So we need your input. We've come a really long way. Elizabeth will talk a little bit later about the Current Smart campaign. We've had new signage specific to structural currents. We've had the database, new research, new equipment, new outreach, and just a whole host of amazing accomplishments that we could never have done by ourselves. We did it together. So that's a very important thing to remember. We need everyone there to stop the cycle of drowning. So if you want to be a part and help us out, we're going to have a water safety consortium that's developing. We have a leadership team that's going to meet next week, but we need an advisory team. Leadership team is going to be made of a whole host of different people from different groups, but the advisory team is going to be made up of you. So this is just the general list. We got people from Sea Grant, we got the Great Lakes Surf Rescue, Michigan Tech, researchers, Weather Service, everybody's involved. So you are the one that we need. We need your expertise. Even if you're just a person who's interested in water safety and you've seen these happen in your community and you're worried, we want your opinion anyway. We don't care if you're a scientist or what. We want to know what your opinion is because usually those people have out-of-the-box ideas that us scientists sometimes stay in our little box and don't think about. So the question is, are you in or are you out? That's my really quick presentation. So apologize. There won't be time for questions because I planned 20 minutes. So come find me. I'd be happy to talk your ear off. Thanks. Hopefully it wasn't too bad.
Thanks, Megan. We could do some questions at the end.
I'm going to pass around a sign-up sheet for that consortium and also some handouts. So if you want some.
And I was going to add, I think I have another work group to be a part of. Thank you for that.
Okay, great. Yes. All right.
Water. Our next speaker is Eric Wiegert. He's with the New York State Department of Health. He's going to discuss drowning epidemiology and reducing drownings using the Haddon matrix. I was actually going to walk around the camera and make it look like I was something new, but in the effort to save some time. So a brief overview of the presentation, give a little bit of background, our process to investigating drownings, talk a little bit about some of our findings, which Megan had actually just also presented some similar material, some of our prevention efforts, and then some questions. So some background. New York State beaches. We've seen this Coney Island picture earlier. The one on the right is Jones Beach State Park down in Long Island. New York State it's a big state. We have a high population. We have a tremendous public infrastructure to provide access to recreational water venues. We have 7,500 public swimming pools, around 1,500 beaches in the state. And so the take-home message here is we have exposure to potential drowning hazards in New York State. These are those same beaches after the Beach Act. No, I'm sorry. It's actually, these are the same beaches after listening to Michael Beach's presentation on brain eating amoebas. No, actually, just want to let everybody know that we do have some more secluded, pristine beaches in New York State also, even in our post-superstorm Sandy world. So everyone, come to our beaches. It's a wonderful place to vacation. Okay, for the researchers and the engineers and the mathematicians in the audience, this is the math component of the presentation right here. So here's our formula. Drownings equal preventable, not equal to an accident. There's no such thing as an accident. We're all scientists, right? You already admitted that you're explorers. There's no such thing as an accident. Everything is a preventable occurrence. In New York State, we've been investigating drownings at our regulated swimming pools in beaches since the 1980s. This process is applicable to our public pools and beaches. Of course, there's obviously some translation to private and non-regulated entities. In New York State, a beach is permitted, much like a restaurant. It's inspected annually. We have a whole slew of regulatory requirements for not just for water quality, but for safety and drowning prevention as well. So we're kind of lucky in that regard that we've had this regulatory infrastructure which supports our cause to reduce the rate of drowning in New York State. This program is implemented by our 46 local health departments across the state. I'm in a central office role where we kind of would consolidate the information and oversee the implementation of the programs. So we'll now jump into our process. So is what we do. I see a lot of people are using these type of little diagrams here today. John Walton from EPA. I think Virginia had one too. So this must be the new trend to use these easily obtainable Microsoft tools in order to present our goals and objectives here. So we have our, it's always nice when something's canned, right? So here's our process. We investigate and collect information. We analyze and develop interventions, and then we're preventing drownings. Pretty simple process. I think we'd all agree, right? So, but getting into a little bit more of the technical aspects, we're doing epidemiology here. We're trying to have inform our guidance and decision making based on the data. That's also been a theme throughout the whole conference, and I think a number of speakers have mentioned that today, including just now. And I had a quote going back to Lord Kelvin, of all people, who said, "You can't manage what you don't monitor." So this whole idea has been around for a long time, but we all get caught up in our jobs, and we're all trying to do the right thing. But of course, if you've ever tried to write a regulatory justification without data to support it, good luck with that, right? So, or even just policies and procedures that are optional. So, taking some scientific model here, the epidemiological model, which describes the interaction between the environment and the host and an agent, which in most cases is going to be some kind of pathogenic organism. But this same model can be applied to injury prevention and to drownings, believe it or not. So if we're minimizing or removing the interaction between any of these elements, right? And so the host would be the victim. The environment that's pretty self-describing, right? And the agent, in the case of a drowning, would be the inhalation of water that's going to interfere with your physiological processes, right, and resulting in potentially death. Just a different way of looking at it. Now, others have taken that epidemiological model and applied it to injuries. John Haddon was the head of the national, I don't know the full entire organization, Traffic and Safety Administration. I believe he's the scientist that resulted in all of us having to wear seatbelts. So he's the guy that you can thank for that. So he devised a way to study injuries using the epidemiological model across the timeline of the event, right? So we're looking at pre-event, event, and post-event phase. So if any of you here were thinking that this matrix was, something related to perhaps a large consortium of people that are plugged in the dark, being used as batteries with a virtual reality world, simulating what the world is, the universe is actually like. So any science fiction fans here? I'm trying to keep you guys awake. If I go off on these tangents, you go, what is he talking about? It's not that matrix. It's this matrix. Okay. All right. Sorry. It's been very usefully applied in other aspects of public health, and actually recently over the last 10 years or so for anti-terrorism response activities. So it's a very simple way of taking epidemiological model and looking at things across the timeline of the event. All right, so moving on to our investigation process, utilizing these strategies and techniques. So when we have a drowning at our facilities, we have mandatory surveillance and reporting. And there's an investigation that has to occur. Our local health departments are accompanied by our regional office staff who have a higher level of expertise, and we guide that whole process through central office. And throughout this process, they're collecting information about the facility and environmental information. We're looking at supervision, quantity, and quality. Right, so not just how many lifeguards were there, but what were they doing? Where were they stationed? We're analyzing emergency response. We're interviewing people. There's a lot of qualitative data that comes in through these mechanisms. We're talking witnesses, the supervisory staff, and victim contacts, including talking to the family members of the victim, which is certainly not an easy process. And sometimes in successful near-drowning incidents, we talk to the victims themselves, because who better to provide that information, right? And then, of course, we're reviewing records and reports, everything from medical examiner, hospital, ambulance, police, and the facility reports. And so how do we collect information through all these local health departments that are assisting with this process? We like to develop tools, right? And we've done this through in Great Lakes with sanitary surveys. We're standardizing the data elements. You build tools, you'll get the data. So we develop these tools, provide them to the field offices, categorizing the data in accordance with epidemiological model and Haddon matrix. And of course, we're always walking that fine line, trying to balance the quantitative with the qualitative and be able to provide tools so that we're using open-ended questions, but still able to steer the process of obtaining this information. Because what's it like talking to people after they just witnessed one of these events, right? Everyone just wants to do a mind dump, and you have to use your interviewing skills in order to obtain the information that you're really trying to collect to help your prevention efforts. So we'll talk a little bit more about our findings now. On to the next piece of the pie. So from the late 80s through now, this is a breakdown of the drownings that we've had from both in swimming pools and bathing beaches. And for those of you that like numbers and are paying attention, is that anyone here? Some of you are paying attention. It's just roughly the same number at pools and beaches. Were any of you paying attention when I talked about the number of pools versus beaches? So there's a lot more pools, but the numbers are the same. So what does that say about beaches? It's more risk, right? Potentially having to do with those two pictures that we saw earlier. All those people, all that exposure, right? And so we have a nice downward trend. We like to see that. New York State actually has consistently one of the lowest, and it was the lowest drowning rate in the whole United States for a very long time, despite all those people and all that access to water. We look at a breakdown of the types of pools and beaches where these things occur. Some of them are in these different subcategories of facilities like hotels and motels, state parks and children's camps, whatnot. The big green pieces there are like our freestanding beaches, like a municipal beach or a municipal pool, which are the larger ones where most people go to. And a breakdown here of age and sex. So it's not just little kids. It's the risk-taking age groups in here. And of course, it's the males. And there's a lot of hypotheses that we can say. Is it risk-taking behavior, right? Is it that, one of the forefathers of this whole process, Doug Sackett, who's very much involved in model aquatic health code work, you may have heard, he used to say that the women didn't want to get their hair wet. So, and I will take things to even a more degree, more potentially inappropriate, and say that, all these gentlemen are taking these risks because there's a lot of women around wearing bathing suits. So water depth, it's not just deep water. We have a considerable number of incidents that occur in shallow water too, less than 10 feet deep. And so in breaking down contributing factors, kind of using the epidemiological model, we the way that this has been done historically, and we're working to revise these data now to have something a little more robust, as you can tell from some of the polyester plaid-like checks and some of these indicators that break down these different parameters. But we're looking at victim, environment, and supervision. Supervision is really a subset of environment. And we see what's our number one contributing factor over here. Water clarity. Is that something that we might be able to deal with from some kind of intervention at beaches? Of course. Over here, number 2, strong current, bottom conditions, excessive depth. Moving on to contributing factors for supervision. We have lifeguards distracted, no victim recognition. One of the reasons why I invited Dr. Pia, who was unable to attend here, and he sends his apologies, is that he was one of the forefathers of identifying exactly what a drowning victim looks like, and to be able to provide the tools in lifeguard training courses so that they can identify a victim in distress, right? So this instinctive drowning response. Can you call out for help if you're drowning? No, you can't. You can't. You cannot. And your body is often vertical in the water, trying to push yourself up, and those hand motions are often mistaken for people waving. We've had that, and actually parents saying, "Oh, I thought my child was waving at me. I didn't even recognize that he was drowning." So some other findings. Moving on to contributing factors in the victim category here. So we've had some seizure disorders, developmental disabilities that we've identified. We've had more policy and education guidance in that regard. So if someone we've identified this, if someone has a seizure, they would be fine. They go back into the water, and that's when the drowning would occur because they had a second seizure, right? So if you have a seizure, you're not supposed to go back in the water at our regulated facilities, and the operators are aware of that, and we'll discuss some of the interventions that we have. Of course, hyperventilation and underwater breath holding. Has anyone heard of this as a new contributing factor? Drowning, of course. So those games of holding your breath and breath holding contests or these things that people do to try to help train themselves so they can stay underwater longer, extremely dangerous behavior. We've had some educational interventions in that regard. And then, of course, drugs, alcohol, and medication, right? So it's the victim's fault that they drank too many humaluma-licious. Is that how you say it? I'm not from here. I have a hard time saying that. Right. So it's a contributing factor. We would collect that information. But, of course, I'll back up and say, well, what is a victim trait here that we might think is obvious that's not up here that we're not looking at? Anybody? Swimming ability, exactly. We're not categorizing by that. And why is that? Because of this, right? We shouldn't be blaming the victim and their traits and behaviors as the sole reason for the incident, right? Would we do that for recreational water illness? Right? Oh, this whole family got sick. Well, that's their own fault. They should have had their own mobile qPCR lab to bring with them when they went to the beach. It's so obvious, right? No, we wouldn't do it in that case. We shouldn't do it in this case. Do we collect the information? Yes. Are there underlying medical conditions that we want to collect? Yes. Drugs, alcohol? Yes. We collect the information, but take the blinders off. Look at the big picture. All right. Now moving on to some of our prevention aspects. Another piece of the pie. All right. So what we've done, we've taken all this information and we're able to have guidance and regulatory reform and policies and procedures that we can implement in order to reduce the incidence of drowning. So, of course, we want to try to do this at the pre-event, prevention, pre-event. Look at that; those words almost match, right? And setting the lifeguards up for success with facility design, capacity restrictions, the lifeguard training. In New York State, we don't just take any lifeguard course; we actually review and approve them for content, and we have our own list that's out on our website. It's a very lengthy process, and of course, including instinctive drowning response. We're looking at the quantity and positioning of lifeguards, not just the number, but the positioning. We've seen blind spots and a number of other issues, so we're looking at things like that and have guidelines in place. Providing direct supervision, limiting duties. Lifeguards shouldn't be cleaning the pool or fixing the filter. They're there to provide surveillance. And then there's cell phones, right? We have seen that too. We also had the ability to have this risk management plan to kind of fill between the gaps of our regulation, where we can provide site-specific details for drowning prevention, which is including responses to adverse environmental conditions such as current and waves, things along those lines, including establishing a network of communication throughout all of our, particularly down in Long Island. We're taking information from NOAA with their rip current alerts and sharing all that information and developing protective strategies, closing off certain sections of beaches if needed. And then we also look at the post-event regarding incident response, training, communication. So did they have the proper training? Did they communicate properly? Were they able to enact their emergency response system, and did they apply treatment in accordance with their training? And again, something unique in New York State, we recognize that CPR certifications are only good for 1 year. You need to be continuously updated with that information because you're not practicing it. A lot of the providers issue certifications for greater than 1 year. 1 year is what the data shows for recollection and recall and practice. So where are we going with this in the future? You know, some of our data elements are crude, some of them are kind of ambiguous. We like to see greater precision and greater data resolution. We've rebuilt our whole database and we've updated our tools. We use the Oshkosh model of human capital. I heard it referred to the other day, of using interns, because in this world, right, in this world of doing more with less, my son actually ran out that equation the other day, right? If we're continuously doing more with less, where does that end up? You're doing everything with nothing, right? So interns, it's a great way to help get work done, and they're fantastic to work with. So we're moving to update our tools in order to be able to identify future interventions and opportunities to continue with our process here. And I thank you. And here's some acknowledgments. A lot of great mentors listed up there, and staff back at home, and Stephanie, who's here today. And do we have any time for questions? Someone ask the moderator.
Is that data available online?
Is your data available for us? We have some networking to do, for sure. Yeah, let's do that.
I'll do this so you can answer. I'll get it ready for the
Sure.
next speaker.
Anybody, any question?
Was there a year that you noticed a significant reduction in drownings when you implemented your program, or what was the?
And that's the kind of data resolution that we need to be able to pull out. So we've done a number of changes with, for instance, that risk management plan. We really updated that recently to include a lot of the contributing factors. Maybe that's like 6-7 years ago. So we really want to get in and to be able to tease that type of information out. We're not quite there yet, but we will be soon.
I was just going to ask, I mean, is there any utility to state environmental health directors, state APIs, kind of putting pressure on some national organization to create the database to collate all of this?
I think that would be a wonderful idea. Sure. So the question is it worth having any kind of initiative to coordinate states through environmental health or other avenues to be able to compile data and share and see what others are doing? And I would say yes. I had no idea that NOAA was doing what they were doing. So yeah, and it's difficult to get that kind of data resolution out of all those rescues. We don't even ask for that.
Well, that's one of the things I struggle with, contacting the right people who collect the reports and the interviews. And so that's something that would be good to talk about.
Yeah,
especially for New York.
And we're only doing this for drownings and for near drownings. We don't do it for every rescue.
It's okay.
Is there one of you in every state in the union?
Well, until today, I thought New York State was the only entity that was collecting these types of information, honestly.
I know a lot of the cities and stuff locally collect their data as well. Like Marquette up north had their own, they had the incident records and they had it all broken down by age and where the incident happened and why. So locally, I think a lot of places do.
So
Just
there is
getting
no
a hold of
national
records.
network.
No, and that's what Michael was getting at. Yeah, there is no national network. And should there be? Is there consensus here? We like to vote around here, right?
There should be pressure applied.
Yeah, pressure applied. So go back and tell your bosses, or if you're a boss, then apply pressure yourself. How's that? Mine's not listening, so I can say things like that. All right, Our next speaker we're going a little bit out of order here, is Brent Schleck, Coastal Storms Outreach Coordinator from Minnesota Sea Grant.
Great, thanks so much, Eric. Yeah, so those of you paying attention to the agenda, my name is not Chin Wu. My name is Brent Schleck. I'm in a joint position with NOAA Office for Coastal Management and Minnesota Sea Grant. I'm located out of the Twin Cities. Today I'm going to talk about two projects that the Coastal Storms program has been fortunate enough to be involved with that are both exploring ways to reduce swimming fatalities. So first is a coupled outreach as well as an equipment distribution project that is led by my esteemed colleagues Elizabeth LaPorte from the University of Michigan and Todd Breiby with the Wisconsin Coastal Management Program is also going to be speaking to this. And then the anchor for this session in the next presentation is Gene Clark, who will be presenting some of the information for Chin Wu's project, which is an innovative rip current detection or real-time rip current detection program research project that's taking place in Port Washington, Wisconsin, and Milwaukee, Wisconsin, as well as Duluth, Minnesota. And Gene is with Wisconsin Sea Grant. So just to give a little bit of background, I'm here because Coastal Storms program is, again, fortunate enough to have funded these two projects. And just for a very high-level background of the program, some of you might be having a Bill Murray in Groundhog Day moment. They're like, well, haven't we heard this before? Well, you have if you happen to attend the Toronto meeting last year. I gave a brief presentation about coastal storms. We were talking about some of the initial efforts that the program is focusing on. The program itself moves from region to region. And in 2011, it came to the Great Lakes and started focusing funding as well as bringing some staff capacity on board to address some key issues in the Great Lakes, one of which, we have 4 focus areas, but one of which we'll be talking about today is improving beach hazards, observations, modeling, and risk communication. And the program now is transitioning out of the Great Lakes and will be focusing on the Mid-Atlantic going forward. But the nice thing is that the initial funded projects in the region are now starting to see a lot of really great results, and we're happy to be here today to talk about some of those. So because the program moves around from region to region, when it comes into a new region like it did in the Great Lakes in 2011, the first thing is to make sure we have a good understanding of what has been going on related to these focus areas in the past. The last thing the program wants to do is to come in and fund or conduct research that would be duplicative or, God forbid, counterproductive to what some of the great groups in the region are doing in this effort. So as far as the hazard communication side of things related to dangerous currents goes, there was a lot of work that I'm sure many of you are familiar with and many of you are likely part of before 2011 and leading up into that. So we wanted to build upon these past investments, some of which include Great Lakes Restoration Initiative funding that has gone toward beach-specific websites, like parkpointbeach.org is one example. There are other examples in Lake Michigan for this as well. Similarly, coastal zone management programs and sea grant programs, as Megan mentioned in her presentation, Michigan Coastal Program and Michigan Sea Grant has been heavily involved in this work. And so a pretty concerted effort was done early on to make sure we were coordinating with them, and so that any projects that we were funding were building off of the work that they were doing, or at least complementary as they were going along in tandem. Similarly, there are various non-NGOs that are very active in the Great Lakes, like the Surf Rescue Project, others like Great Lakes Commission. Many of you are familiar with their My Beachcast mobile app that the Great Lakes Restoration Initiative funded to produce a mobile app for Android. Coastal Storms provided some additional funding recently to expand that, and so now it's available on the Apple iOS platform. So hopefully all of you with iPhones can now download that. I know I did so we're excited to be part of that project as well. And then of course the National Weather Service in the Great Lakes, and Megan mentioned all the great work that they're doing. So the coastal storms, we wanted to build upon this, as I mentioned. So the first thing we did is funded some risk perception and social science work. So looking at how folks perceive risk in the Great Lakes. This looked at testing draft messages, as well as looking at the best mechanisms for conducting outreach, what had the most bang for the buck, and what were the most impactful ways to communicate to Great Lakes beachgoers that are at risk, which mainly, as Megan mentioned, young males as well as parents with young children. Similarly, there's the other outreach components that followed from that, like funding the My Beachcast app to expand some of their capabilities, as well as the Communication Best Practices Project, which Elizabeth and Todd will discuss here in a minute. And that's a coupled outreach and equipment related project looking to improve beach hazard awareness in the Great Lakes. And finally, there's more of a research side of things. So recognizing that there are several data gaps in the Great Lakes, especially in nearshore currents, we were able to fund some or provide the Great Lakes Observing System, GLOSS, some funding to put some buoys in the Great Lakes that would help the Weather Service improve their forecasting. So we have 2 buoys in Lake Superior, 2 in Lake Michigan, and 1 in Lake Erie as a result of some of this funding over the last 4 years. We're pretty excited about that. And then finally, this relates to the project that Dr. Chen Wu is doing out of the University of Wisconsin-Madison, and Gene will talk about later today, later this morning, which is a pretty innovative rip current detection system that they're piloting. So again, I'm not going to spend too much time on this. Megan gave a great presentation talking about some of the challenges that we see in the Great Lakes, but as many of you know, well, the Great Lakes has around 10,000 miles of coastline, and so there are thousands of beaches here in the Great Lakes, many of which are excellent for swimming. But because there are so many beaches and because it's such a broad geography, there's and the expense of having lifeguards that not all municipalities and parks are able to staff their beaches with lifeguards. And so that, coupled with a limited amount of equipment in the Great Lakes, leads to a lot of potential risk for folks who are at the beaches who don't have access to either lifeguards or equipment to help them out if they get caught in a dangerous current. Similarly, things that we heard through our social science work is that one of the most important aspects of an outreach campaign is to be consistent. If you think about things like stop, drop, and roll, the reason why it immediately comes to mind is because it was really hammered home when we were growing up, and it's a very consistent message that we heard for years. There needs to be an effort, and one of the needs that was identified there is an effort for a consistent messaging campaign across the region, not just within counties, not just in parks, not within states, but even across the Great Lakes region as a whole, to help get some of these ideas and really, or get some ideas across and really drive them home for some of the folks that are most at risk. And so what this led to is a regional response. And as I mentioned, there are two projects that we'll talk about today that Coastal Storms had the opportunity to fund. The first was a extensive region-wide communication and equipment related project. And this was primarily led by groups by Sea Grant and Coastal Zone Management groups out of Michigan, Wisconsin, Indiana, Illinois. And it also involved some folks in advisory capacity in Minnesota and Ohio as well. Again, recognizing that there needs to have that consistent aspect to messaging. And, and I think from there, again, driving home that consistent messaging, but also having a way to distribute equipment at a regional scale, not just at a very small pilot location, but able to hit areas from Duluth all the way through the Great Lakes as we go east. So from there, I will pass things off to my colleague Todd Breiby with Wisconsin Coastal Management Program. He'll talk about some of the equipment. And then I think from there we'll head on to the research as well as the communication.
So it actually kind of feels like a soccer match. So, so I don't know if we need to tag in and out of this, but so first I'd like to acknowledge NOAA Coastal Storm Program and Brent Schleck for their support and partnership on both of the projects, including this one that I'll be speaking on, and the next one, Gene Clark. And I'd also like to acknowledge Gene, who is my Wisconsin co-coordinator on this specific project. And like Brent said, I'll quickly touch on the equipment process of this portion of this project, and then I'll delve a little bit into Wisconsin-specific deployment, and then I'll turn it over to Elizabeth on the outreach campaign. So I think the two main takeaway messages for the equipment portion of this project is that there were two elements that provided that enhanced the success of our deployment in targeting locations that needed the equipment, and both of those, and especially on a regional large scale. And so data was very important to us, as well as the using of state working groups. And I think both of those elements really provided the support we need to make sure we were actually locating equipment in the right places that would be the most effective. And so Megan actually talked earlier about the incident database, and that was a primary source for us with the fatalities and rescue data that National Weather Service would upload on an annual basis. That provided, I think, a central core element for determining where we should actually locate this equipment. And so thanks to National Weather Service and Megan, you can actually, I don't know if the website was brought up, but you can actually access that information on dangerouscurrents.org, which is a website that was developed in partnership with between Michigan Sea Grant, State of Michigan, National Weather Service, and Michigan Tech. So it's a wonderful resource on everything currents in the Great Lakes, basic information, and that's where you can also find the database as well. Two other considerations that went into building the strategy of where we should actually locate equipment was the Great Lakes Surf and Rescue Project, mining that information that was available through that and the media that they gathered, in addition to looking at estimated beach usage and visitation. A lot of information came from local municipalities, as well as in Wisconsin's case, we also utilized the Wisconsin Harbor Towns Association, which is a tourism trade association, as well as our own Department of Tourism. So all three of those really kind of played a role in where we are going to put this equipment on this regional scale. The second element I talked about was really working groups, and the working groups are really key for a lot of different reasons. And I kind of summarized in bullets here the value that they added to this project. And so each state actually developed their own working group And I think a couple things to really highlight is a lot of it, the working groups provide an opportunity to really inform our stakeholders about rip currents, just what rip currents are. And I think one thing that you see in the Great Lakes is there is a really gap in information. And so I think those working groups provided that catalyst to allow us to be able to better explain and explore rip currents and talk to them, and therefore use them as a tool to disseminate that information to a larger beach stakeholder base. They were instrumental in vetting the selection of the equipment and locations, I should say. In addition to discussing specific needs. There's things that they see on the ground that we don't, and so they provide a lot of valuable resource information to us. In discussion about, managing equipment, a lot goes into it. So we really work with our working groups to talk to them about the need to tag equipment to prevent theft, looking at loss and damage. Storage, what are proper ways to store equipment? Also, where do you locate equipment? Where do you want to put your ring posts? Where do you want to put your loaner stations for life vests? And so they were a conduit to help kind of formulate that and then disseminate that out to statewide and region-wide. I think the other thing too that they were very invaluable in is providing expertise, but also leveraged opportunities. So whether that's financial resources for additional equipment or what have you, the state working groups provided a framework to help improve and promote sustainability of this effort. This is, you can't see the details of this, but this is just a snapshot of an Excel spreadsheet of all the equipment that was purchased through this project. And we have exact specs as well too. And I think one thing to note is that there was a pilot project on beach safety kits in Michigan that was led by Michigan Sea Grant in the state of Michigan in 2013, 2014, that kind of vetted a lot of the equipment that was available out there for beach safety or water safety. And there were representatives from first responders, National Weather Service, U.S. Coast Guard, and others who provided feedback on that equipment. And so that, I think, helped vet the initial process of what are the most appropriate piece of equipment that we should be making available through this project. And a lot of the equipment as well, I should note too, also comes with are constructed using U.S. Coast Guard approved material and ratings as well too. So the types of equipment that we provided were throw rings, throw bags, rescue boards, adult and youth life vests, rescue whistles, etc. So it was a wide array of equipment. And one thing to note too is we also collected the GPS locations of the beaches that actually received equipment. And this is going to go to informing how we move forward with future deployments, future investments with purchasing equipment. So we're collecting all that GPS information, and we have a really good understanding of where everything was located, and then we can at that point, look to the future and where locations we're missing and where we put future investments in. Here's a few images. In addition to, you've got the Carlson board, you've got the life rings, you've got the rescue tubes, throw bags. One thing that was also nice about this project, especially for Wisconsin, was that we were able to not only deploy equipment, but we were also able to work with communities to erect rescue stations, whether it's a ring post or what have you. We were able to at least these rescue stations a couple of them were actually erected, I think, as part of this process, but also earlier. But it also gave us a chance to work with these communities on how to best deploy and make these available to the public or to first responders. I'm going to launch a little bit quickly into specifically Wisconsin state examples. And so with our working group, concurrently at the same time, we were in the process of putting together Wisconsin Coastal Beaches Working Group. And that working group, which previously in Wisconsin always dealt with water quality issues, beach restorations, re-engineering and all that. But this opportunity provided for at least us in the state a framework of how we could use a state working group to help implement this project within the state. And so as that process was ramping up, Gene Clark and I actually came together and actually in Wisconsin put together this working group that was made up of state agencies, state parks, local health departments, local state parks, et cetera, National Weather Service, that all came into play. And if you can see the members I just mentioned, Udo Oshkosh was also very instrumental in playing a role in our working group as well. And the roles that they had are very similar to what I mentioned before. The first four bullet points really kind of target equipment and deployment. Elizabeth is going to talk about this, but the fifth bullet point is talking about the outreach campaign. We found the working group to be really instrumental in helping to get the word out there about rip currents and safety through that campaign. So they were I think, a very good partner in that. The last two, again, I mentioned is looking at how do we enhance the project in Wisconsin and use leverage efforts. And so in Wisconsin, I think this group really played a key role in helping how do we build sustainability within the state itself. If you look at our numbers, we actually provided 165 pieces of safety equipment to 41 beaches and 1 coastal structure. 7 of 15 coastal counties are covered. Most of the beaches, which is true Great Lakes wide, most of the beaches that we deploy equipment at were unguarded, which is great, and included both Lake Michigan and Lake Superior beaches. And all of them were all either state or publicly owned, or all state or locally owned, I should say. And so with this, I think we've got a good idea of where we want to go in the future. And what I mentioned too about leverage resources. So as part of this process, I think what was nice that came out of it is as part of this working group, UW-Oshkosh stepped forward, and they had enough funding that allowed us to them to purchase an additional series of beach safety kits that we could actually supplement and target and deploy that equipment at 4 coastal beaches in Door County, all locally owned either by the town or local village. And so that was something that was, I think, a nice leverage example of what we did and the benefit of this working group. And then again, coming back to the Wisconsin Coastal Beaches Working Group, this larger concurrent effort that we're putting forward to deal with water quality, they've now, we've vetted the process, and they've also agreed to actually take up the issue of dangerous currents and beach safety. We have an upcoming meeting that we'll be talking on advisory communications as well. And I think they're going to provide a state-level sustainability process for us as we move forward. And with that, just let you know, this is just the kind of outcome. Over 1,800 pieces of equipment were deployed, which is great. You see the specs there. We also have a survey that went out to recipients of the beach equipment, and we're gathering the information and analyzing it right now. And a lot of it's looking at efficacy, theft, loss, damage, and a lot of that results. And a lot of that's going to provide feedback information on how we move forward in the future as a region and for each state as well too. So with that, I'm going to hand it over to Elizabeth.
Okay. How are we doing on time? Okay. I'll just keep going. Okay. Which one have I got here? Just either left or right? There we go. Okay, so to get to the good part. A lot of this is all related to how do we raise awareness about the fact that these fatalities and rescues are occurring. It wouldn't have happened if the National Weather Service hadn't started collecting the data to begin with. And so, as was mentioned earlier, we relied heavily on that. But at the same time, we wanted to pair that up with talking about the fact that messages to date have been very confusing. So this is like a small collection that I have now of hundreds of signs and other messages that all said a little bit something different. Okay, all right. So we worked hard on trying to hone messages through DEQ and our work there, and then just kind of apply that regionally. So these are some examples of what we've done in terms of regionalizing. This is the what we're calling the existing break the grip of the RIP diagram and signage. We went with something that was a little bit simpler and then kind of tailored to the Great Lakes region, where it's not just about rip currents, as Megan noted, it's about a variety of different currents. And so how could we inform people that there were a variety of risks associated with swimming in beach areas? So we came up with this regional campaign, which has been alluded to, and we determined that based on the data, there were 6 messages that we really tried to get across. And we did that through videos, video animations that were specifically targeted toward a younger audience, and then some other products. So go on to the Current Smart website. All of that information is available. There's a whole host of information. And then if you need more things like beach signs, want to have templates for publications and things like that, there's a connection from here to the Dangerous Currents website that has a lot more information about the research and other things that have been conducted over the past 6 years or so. So here's just a little sampling of what these things look like. I want to credit Illinois-Indiana Sea Grant. They came up with a really robust social media effort that I'm not going to go into, but part of it involved Facebook and Twitter and other things. And, you know, people still kind of snicker a little bit about Twitter and some of the social media, but believe me, it was really, I think, impactful in this way, and I think we're going to still see some good data coming out of it through the end of this project, which is June 2016. So these are some of the things that were done. I'm going to, again, burn through this a little quickly. And then I already alluded to this parent website, which we've been developing with support from the Michigan Coastal Management Program. And again, you can get to all of the data that's online that Megan is updating annually in terms of what's happening in terms of rescues and fatalities in the Great Lakes. So to come, our group is still working. There's still going to be some equipment distributed to targeted locations around the Great Lakes region, and then some publications that will be distributed as well. So just a thanks again to NOAA Coastal Storms, the NOAA National Weather Service, to all the Sea Grant programs in the region. I know that I talked with some of you last year. Some of you were in Toronto. And so we're hoping to get more of the beach managers engaged. That's really important to us. And so please follow up with Megan, some of the Sea Grant folks, other people, and thanks for your time.
And our next speaker is Gene Clark, who's going to talk about the integrated Nowcast-Forecast operational system. INFOS is the acronym for Rip Current Observation, Prediction, and Warning in Lake Michigan.
This one?
Yep. Good morning. I have bad news and good news. The bad news is, for those of you expecting to hear Chin Wu talk, he's not here. Chin comes up to about here on me. However, he sent his PowerPoint last night about 10 or 12 p.m. So you were sitting, and it had about 50 slides. So since he's not here, I'll get us back on time. So I need to, but seriously, this is a 2-year project. Again, part of the NOAA Coastal Storms program. Big title, Integrated Nowcast-Forecast Operational System. Chin loves acronyms, so it's an INFOS project. But it's basically for rip current observations real time as well as predictions in the future, and the same for waves, measurements real time and in the future. Chin is the main PI. He and his grad students do the heavy lifting with all the research. Todd Breiby, the Coastal Management Program from Wisconsin, and myself, Wisconsin Sea Grant, Coastal Engineering Specialist, are mostly the education and outreach portion of the grant, as well as deckhands for putting the equipment in and out. In fact, that's the reason why Chin couldn't be here today, is he's outputting one of his instruments. Again, the objective of the project is to try to design a system that could be used at a beach that would record existing rip currents if they're present, as to give a warning, as well as look ahead, like in the day, or what's the likelihood that rip currents would occur, both structural and regular beach rip currents, and the same with dangerous waves. Many project partners. We talked about the University of Madison, the Civil and Engineering Department, which is Chin and the students. Myself, Todd, with Coastal Management. We worked with Minnesota Sea Grant, NOAA Coastal Storms, National Weather Service. GLERL utilized a lot of their current and wave modeling, and you'll see what's being done through this project. and then the cities, the 3 test cases. Again, the tasks to come up with a real-time observation system as well as predictive for both rip currents and dangerous waves. This is the Duluth project location. If you remember Megan's slide, there was a very tall number of occurrences there. One beach, Park Point Beach, which is why when Brent talked about parkpointbeach.org happened, because one beach for the cities of Duluth, Minnesota, and Superior, Wisconsin, as well as all the tourists that come up from Minneapolis, St. Paul, which is many. So we chose that location. We chose Port Washington, both because we have a very good working relationship with them. There was a rip current fatality there. And then the county of Milwaukee, it's in particular Bradford Beach, which is a very highly utilized beach in Milwaukee. This is what the instrumentation for the rip current measurements. It's a wide vision, high resolution webcam that's posted near the beach, and this is the example of the instruments at Port Washington, which we luckily had a water treatment plant there that we could use as our base of operations. And it overlooks the beach. It collects the images, goes through data processing at the University of Wisconsin, and then out will come the products that I'll share with you. And we also shows locations both at Bradford Beach in Milwaukee, which is right at the beach house overlooking the beach, and for Duluth on a tall cell phone tower that overlooks the beaches there. For the waves, we just had a small underwater wave sensor and frame that we deployed at each location, or going to at Duluth, and we just did in Milwaukee. The wave sensor at Port Washington was put out just about 100 feet or so, and here's the beach that we're trying to do our measurements and our predictions for. This wave gauge measures the wave amplitude in real time and measures the currents in real time, as well as the water temperature. So we can post that on the website. And this is just a schematic of what the info system is. It's 2 measurements, both waves and the rip currents. The most important part about this webcam is it has the capability, along with the software that it comes with, to detect water particle motions. So that's why it overlooks the actual beach, and through the computer programs, we can diagram the actual current, the surface currents that are existing. So you could see if rip currents were occurring by watching those water particles through this program, or if there were structural currents. So we tried to choose locations that both had a structure where people like to jump off on, as well as the beaches where we knew rip currents did occur. And then we would process that. We would utilize the wave and current models from NOAA GLERL here in the Great Lakes, recognizing that their nodes for their data points, though, are large. For any of you that have ever looked at a nearshore weather forecast for a beach, for Milwaukee, which has several miles of beaches, that nearshore forecast is based on 2 nodes, 2 offshore nodes. So this program was meant to use those 2 and then to try to take nodes like every square meter. So we really could get a close-up estimate of what the forecast would be for those beaches. Quickly, there's the website, the main website. They now have an app, and it's only in the first year of a 2-year program, so you're going to see some partial products. Chin had sent me a very detailed PowerPoint, and if you email him, I'm sure he would love to give you that. and you could see some more details. But very simply, the home page has a lot of information on. Thank God for graduate students. I don't know where they get this time. But it has the warning portion, and I will show you what the rip current warning portion looks like. It has the actual observations from the measurements, the forecasting elements of the model, as well as these are the 3 beaches, so it uses the same one, even though it's Port Washington right now up there. That will change to show Milwaukee and Duluth. And then the actual weather conditions. So you could have this as an app and know what the conditions are at the beach, as well as the predictions. For the right now, the rip current and dangerous waves warnings was very simplistic. It wasn't based on the webcam. It was based on what Megan talked about, just the height of the waves. Now the sensor has been pulled, so it doesn't show the waves, but anything from below 1 foot would show green in the area, 1 to 2, moderate risk. So kind of going along with the National Weather Service that anything over 2 feet has a high risk of potential rip currents happening. This is going to change as the webcam model gets involved in the program. And this is what just they're starting to see. This is what the webcam at Port Washington and through the computer program, here the waves are very much parallel to the shoreline, so there were no rip currents showing up, but we could see some of the longshore currents already coming. So this would be the real-time picture that a beach manager, a first responder, or even the lifeguards could look at and say, we're recognizing perhaps rip currents. Now we know rip currents migrate like within a 10-minute period, so it's not necessarily going to say, don't swim here, swim there. It's just going to alert you, there are rip currents out today, we've seen them with this tool, so don't go. And then for the waves, when you go to that page, it'll just show the beach and the structures, and it'll show them as vectors. So instead of from the large nodes from GLERL, it'll do it in a much nearer model. And I'll show this with the currents. This is what you'd get through the model if we took the GLERL model and then put it into the model that Shin has with the contours put. I know it's hard to see, there's small arrows there. This is a newer one now showing where the currents are and then color coded for once they start getting higher or dangerous. And you can see for this case, the waves were coming out of the northeast. And there are some locations near the beach where the currents were very high or dangerous. And these are longshore currents. We don't see any rip currents here, but especially the structural currents. And what's kind of surprising are there are actually currents getting past or around the structures and one area where they were very high. So again, these are real-time measurements put into the system and coming up. So this is just a few pictures of the small wave gauge getting ready to be deployed. Before it went in the water, this is just how big the webcam is, getting ready to put out in Duluth up on top of the cell phone tower. And it's, so to sum up, it's a research project, 2-year research project. We're right in the beginning, the 2nd year, so not all of the equipment at all 3 sites have been deployed yet. That's also part of Todd's and my job, is to get the permits for it. For Washington, we utilized their water treatment plant, so getting a DNR permit and a Coast Guard permit and an Army Corps of Engineers permit was just no issue. Duluth and Milwaukee using their offshore breakwaters with nearby navigation channels. We're still working on getting the permits. since some of that equipment didn't get out. But what it will do in the end, it will provide very specific rip current information now, meaning at the time of measurement, as well as a day ahead in hourly increments, forecasts for how those waves and if rip currents would occur, as well as the dangerous currents themselves, both in a now time and then in a year ahead. So that's very simplistic view of the study. Again, if you'd like a lot more details, Jim's 50-point PowerPoint will give you all the numbers and equations. So there, that's
Great, thank you, Gene.
some time for questions.
Yes, indeed. And actually, if anybody has any questions for the speakers, I'm going to refer you to the speakers, right? So I would prefer to have some open discussion. I see Shannon going into panic mode here. And Shannon wants to come up and do a little bit of a vote afterwards too. But so let's keep our exploration going here, right? So do we have enough information to reduce swimming fatalities in the Great Lakes?
I'd say we have a good start.
What a fantastic start this is, right? So it looks like we have some tremendous enhanced data collection going on, and we have some interventions being implemented, right? And soon we'll be able to have data to show if the interventions are working, right? And so I would ask if now that we've opened this can of worms related to this issue here as a topic that's being covered by the Great Lakes Beach Association, so is this something that the association would be willing to compile some information and be able to have some policy recommendations or position statements in order to encourage that we have some consistency and standardization of collecting information and demonstrating data showing effective interventions, and we can share the information with others, like in the fine tradition of the Great Lakes Beach Association, as we've done with monitoring and modeling and so on. I see head shaking. We have a motion going here. We have some movement. The president's in the house.
To give you guys for the webinar audience too, back in 2005, we were all in Green Bay. We put ourselves in a little room, and we came up with a tiered list of priorities that we all wanted. And we had health departments, we had local beach managers, lifeguards, all of these people in the room, and all of us at the state and federal level, we were gagged, like on purpose, we did this to ourselves, to let all of you talk and tell us what you want. So this is an opportunity again where we're doing that, get that feedback. So I guess the next trick will be how do we capture that and bring it in? So
I want to add that this is also part of the Great Lakes Governors Initiative. So our governors have made it a priority as part of the statement. And so part of our messaging as we were starting was to say, this isn't just something we cooked up. The governors from all the Great Lakes states made it a priority as a policy statement more than a year ago. So I think we can use that.
Well, how many state coordinators are in the room? You know, Michelle and me down in Wisconsin, in Minnesota. What is your state? Illinois? So we have everybody in here except Ohio. We got New York. I think Ohio's the only one not here.
Big River or Great Portage, right?
All right. So is this something that each, like you're set, you're kind of moving along. And I think Michigan, we're kind of coming along. Is this something that all the state beach coordinators, we could at least start connecting to the people that are involved in this?
Share some tools, share some data, share some interventions.
And the Great Lakes region, it's really also about, you know, connecting with the coastal zone management programs that have really stepped up in a big way to participate in this. So it's, you know, multiple units of government. Right. And just, you know, the more that we can generate awareness of the issues and try to change behaviors, that's really the goal.
Okay.
Yeah.
So what I'll do, I guess with you being a big, strong lead in Michigan developing a lot of these things, how about we'll get the state beach coordinators together from the states and NOAA And I think Traverse City's working on a lot of stuff right now too. This is kind of why we have it.
I think that's why, that was the objective of that consortium, is developing that group, because we know there's a lot of times where like a small, like some kind of incident will happen, and then a little small task force gets spun up, and they start repeating the things that other people have done, and they may run into the same problem. So we want to make sure that we say, hey, before you even do that, here's how we got around these issues, here's what we did to fix that problem, or here's signage you can use, don't make new signs, we want to make it consistent, we want consistency. So that's the purpose of that group, and we can use that as a forum to go forward.
I would encourage the coordinators to get together, but I like the Green Bay protocol that we used, and this time perhaps we can make sure that the tribes and the national parks are there, and all the other rural wildlife stakeholders. We're obviously not going to get it all done today, so.
Rats. And just to note then that DNR was critical in the work that we did, the park staff, you know, they're seeing a lot going on at the beach. They're seeing some stupid things go on, and it's not that, you know, for a lack of the parks trying to inform people as they come into the beach. Now, some of the social science research pointed to the fact that some people decide they're going to swim, and they're going to swim, no matter if a red flag is flying. So we can't do much about that, but we can at least provide more information. And because we have so few lifeguards in Michigan, DNR is key. DNR is key.
I mean, and even stuff as simple as one of the, I think it was one of the studies actually pointed out, saying something like, you know, you notice that a lot of these facilities for the parks and things are always placed right next to that break wall. So, you know, people want to sit near that facility because they want to be able to go to the bathroom, do what they want to do, especially if they have kids and things. So they're right in that area where the biggest hazard exists. So how can we, you know, obviously we can't do anything about the building being there now, but maybe marking off swim areas, as we know those places that people get into trouble over and over and over again. It is so sad. When you go through this database and all those case studies I look at, it's the same story repeated over and over and over. It just makes me sick. So how can we get people to swim without them really knowing that we're getting them to swim in other places? You know, it's sort of like a subconscious thing. Placing facilities at new beaches away from those dangerous areas. That's the kind of application that we need to do. But, you know, obviously I don't have all the resources to do that. Parks have the resources to do those things. So that's an example, I guess, of how things we can do together.
So it sounds like if we don't have conference calls and emails and whatnot through the next year, we'll probably do something like this again at the next beach conference. Or here's a plug. Is John Watson in here? I don't want to freak anybody out, but, or John, because the announcement hasn't been made, but there probably, most likely, will be a national beach conference. And that'll be sometime next year. So we have an opportunity to kind of raise this up at a national level as well. Maybe tie in even more at a national level, and then bring it back home to the Great Lakes Beach Conference next fall. We'll be at the National Beach Conference in the spring, Great Lakes Beach Conference in the fall.
All this behavioral research and that, is that cited and summarized on the website?
Mm-hmm. Yeah, and I'm assuming we'll have access to these presentations from the conference somewhere. So
eventually, yes.
In my references, I have like 3 slides of references. I put read those references in there. But if you can't find it, just send me an email. I got some of the publications.
Okay, great, thank you.
And if we are going to try to put this on the national agenda, I would encourage Michael to lean into his injury prevention folks at CDC.
Yeah, I'm not an injury prevention. So.
But he knows. But he knows them.
They are. I mean, I do think that there's a role here. Because I hadn't actually heard about your data before either.
I know. I was about to say I heard your talk yesterday because I was like, oh, he's probably gonna. I hope he comes with a talk because we'll probably all get into a good conversation. And then I saw yours. I was like.
There has been conversation requesting CDC to try and get involved at a national level for some of these data collection and everything, because there are lots of groups, and outside the Great Lakes, they want to collect data, but it's hard to collect data. It's hard, and most states are not going to go to anything except the government entity. They won't go to an NGO, and so I think there is a role here, but I do think that
and I think the other struggle is
pressure can be applied.
You can't always identify a specific cause. I mean, even in my database, yeah, I say they're current related, but that means waves also play a big factor. So it doesn't mean that the incidents were only related to current, it just means that it was involved. So even with my data, a lot of people say, well, you can't just say that that was waves or a current. A lot of times it's both. So it's kind of hard to identify specific causes for incidents, especially in cases where you can't talk to the victim, you can't get a hold of the right people. And that's the biggest challenge I've had. Sometimes I go on a phone call tirade going through 5 people and I get referred back to the same person. Nobody knows what happened. So
It's a lot of work for sure.
Communication about where you can get the information about the incidents is a thing to improve.
I mean, I think about from a data collection, national data collection, some of the things that we heard about today. What I'm really interested in are ones that where you can essentially influence design.
Yeah.
And that, like you said, move these facilities to different areas. We're doing this with pools now with more aquatic health codes. If we have data that says a wing wall or a bench is leading to these incidents, you can change how you design it. And the designers are involved in the process. So they're the ones that can come up and say, we could shift this and do things a little bit differently.
This is great. So this is actually the first time we've had a full session devoted to swimmer fatalities, swimmer safety at the Great Lakes Beach Association. I think we've had a few talks in the past, but I think there's a real push for it, and I think these are great ideas for getting a coordinated effort going, because as beach managers, you know, it's not just about E. coli in the water. There's all sorts of issues you're dealing with that that I think there's an opportunity for people to collaborate at these meetings. So it's wonderful. I'm Meredith Nevers. I'm the current president of the Great Lakes Beach Association, and I just want to give you just a little plug about the Beach Association. For those of you who aren't on Beachnet, that's our communication tool. It's a listserv that goes out to everybody. You have a question, you can post it on Beachnet, and you immediately goes to 1,200 people. 1,200.
Just top 1,200 people.
Just top 1,200 people. So if you can't get an answer from 1,200 people, I don't think there's an answer out there. So I encourage you to sign up for Beachnet if you're interested in the listserv. It's beachnet.
Beachnet at something.net.
Great-lakes-net.
Or you can find me and I'll get it for you. Just Google it.
Look for, right, Great Lakes Beach Association.
Great-lakes-net. Right, so we can get that. But there's also a board for the Great Lakes Beach Association. I'm the current president. Also currently on the board is Eric Wiegert, Kim Bussey from University of Wisconsin-Oshkosh, Adam Mednick from Wisconsin Sea Grant, Sonia Joseph Joshi from NOAA. I know I'm going to miss somebody because I started naming them. Kathy Breitenbach from Chicago Park District, and
Is it Claire?
no, Tom Edge from Environment Canada as past president. I'm sure I missed somebody.
We can go to the website.
Go to the website, yeah. So, but we do serve for 2-year terms, and I just want to say that there's going to be an opening starting in January, and it's will be open for nominations for that position. The board meets conference calls basically over the course of the year, and then plans the annual Great Lakes Beach Association meeting. So this year we obviously paired with State of Lake Michigan, and Shannon and her wonderful team at Michigan DEQ did all the heavy lifting and have done a wonderful job this year, which is great. We've really enjoyed it. And we're in the process of deciding our beach location next year, our beach meeting location next year. So as Shannon said, there's supposed to be a national beach conference next year, so we were sort of waiting them out to see, well, were they going to have it in the Great Lakes? Could we meet with them? Turns out they're planning a spring meeting in a non-Great Lakes location, so we're on for fall of next year. So we're still deciding where to have this, and in a very long discussion on Wednesday, we discussed two sort of top locations that we're mostly considering, and we decided we would throw out those 2 locations to the rest of the group to see if there was any sort of leaning one way or the other. So, in a show of hands, we're going to...
also say that there's a rumor about the State of the Lakes Superior Superior meeting. So
Right.
for anybody that's wondering, we've never been to Lake Superior.
Right.
We bounced this conference around. So there is a rumor maybe that we could partner up with the state of the Lake Superior.
Superior, right.
And so that's where we were looking. So if you're wondering why we picked one of the northern cities, that's what she's done.
Yeah, so yeah, and Shannon put, so that's an important point, is that we moved from location to location because then we can get input from local beach managers and county health departments who may not get the chance to travel to remote locations. Last year it was in Toronto, so we got a lot more Canadian involvement, which was wonderful. But certain locations are more easy to travel for some people than others. So the two that we're discussing at length are Geneva on the Lake, which is Ohio, which is to the northeast of Cleveland on Lake Erie, and Marquette, Michigan, which is on the UP on Lake Superior in the state of Michigan. So I'll give you just a moment to think about those locations. And then we'll just do a show of hands for where you would prefer, more be able to travel, one of those. So who would go to Geneva on the Lake, Ohio? Only one. There's only two. You can only choose one. Marquette, Michigan. Whoa!
Check the bias in the room. How many are from Michigan? Okay, so it's not just all of us voting.
Okay, well, appreciate the input, and if you have any other comments, talk to me, talk to anyone on the board. I ignored, of course, I said who's on the board, it's the elected board, but there's also a big advisory board, which is every state beach coordinator is on the advisory board, as well as the EPA, Holly in particular, and several other past presidents or organizations. So thank you, and appreciate you all being here.
Thanks, everybody. Everybody to sign the sheet if they wanted to.
It's 10:30, isn't it?
Yeah. 10:30.
Okay, it's break time. 10:30. Same